And as I mentioned earlier, we would have Ann Wiley here today, and she is here this morning, a little tired. Here you and your husband Bill were down a D-Day for quite a while this past week.
Pretty much every day all week for 12 hours.
That's got to be the biggest of all time, that one.
To me, they're big. Last year was huge, so it's kind of hard to tell.
Yeah, yeah. We've been saying all morning long how amazingly, how many people actually showed up to see this thing and be in the reenactment itself. It was really something to see, and I imagine you being down there, you'd have to be tired.
Oh yeah,
something like that.
Yeah, takes a lot of people, a lot of time.
Yeah, yeah. We wanted to have Ann on because coming up on September 3rd, which is just around the corner, believe it or not, there's going to be a Medicare Seminar, which Ann is putting on. This is a free of, it's not, there's no charge for this. It's going to be held on September 3rd from 10 to noon at the Human Resource Center.
Right.
Correct. And you've been doing Medicare insurance for quite some time now, 30 years probably.
31.
31 years,
31,
over 30
yeah.
years. And since I've been through this, it's not an easy subject to understand. And I've had to rely on this girl for quite a few times to figure some things out. So what will you be covering that day, Ann?
Well, first of all, this is an educational only, so there is absolutely no selling. We will explain Medicare A, B, C, and D. There's 4 different parts, and we'll go through, the 2 different options that you have. A lot of OPERS and GE employees are losing their coverage at the end of the year, and they have to go through what's called One Exchange. It's a company that tries to explain this stuff on the phone, and they have to make a decision on the phone, which is very, very difficult for anybody, let alone people that are 70s, 80s, or 90 years old that are trying to go through this. But this seminar is for anyone turning 65, anybody losing company coverage, anybody whose rates may have gone up and aren't sure what other options they have. We'll go through all of that. We'll go through the Part D prescription drug program, give you some ideas as to how to recheck those again. Open enrollment's coming up October 15th to December 7th is the general open enrollment period.
Can you explain that, Ann, for those that might not understand open enrollment?
Yeah, it's a time that the government allows you to make changes to your Medicare Advantage plans and your Part D prescription drug plans. You have to make a choice between October 15th and December 7th for your coverage for 2016.
What if you don't?
Everything you have continues on if you don't make a change. Okay. You will get a packet in the mail in September. You really want to pay attention to them. I know they're thick, they're intimidating. A lot of people don't open them up at all, which is very dangerous. Some people open them up and look at the rates and say, okay, my Part D went up $10 or my Part D went up $5, and they don't check anything else. Part D, the prescription drug plans change every year. Premiums change, co-pays change, formularies of the drugs change. You really have to check those plans every year to make sure that you're on the right one, because a plan that may be fabulous for you this year could be terrible for you next year, and if you don't check, you won't know until January when you go get your prescriptions, and all of a sudden your inexpensive drug is now real expensive.
So this could affect me then?
It could affect everyone on Part D.
Okay.
Or on Part C, which is the Medicare Advantage plans.
Did get a question that popped up last week, and I said, well, I told Michelle, I go, Ann's going to be on the show next week, so I'll just wait and see if I can ask her that question. It was on Facebook that certain people were saying that they were getting their prescriptions through Plan D free of charge, being sent to their house in the mail.
Yes.
And is that possible?
Yes, it is. Currently this year there's 33 Part D prescription drug plans. Some of the plans do have a 0 copay mail order for certain generic medications. It's usually the real inexpensive medications. If you're good on the computer, Medicare.gov is where we go. You can put your prescriptions in, put the pharmacy that you prefer, and it will go through all the plans next year and let you know based on your drugs and where you go for your prescriptions what the best plan is.
Do you pay more for that particular one that we're talking
Not
about?
necessarily. You could pay a lower premium.
Really?
Some of them have the premiums this year, and we won't know next year until October 1st. Nothing is available till October 1 for 2016 by government rule. But this year, the cheapest one is like $15.60. It has a $320 deductible. The next one is $21.70 a month with no deductible, and then it goes all the way up to $104 a month. It really depends on the drugs that you're on. They are very drug specific. Every company gets to determine what tier they assign the drug to and what copay is assigned to that tier. So we find sometimes that a husband and wife will have two totally different plans with two totally different companies.
Okay.
It's that drug specific.
In my case, I had a problem with, it would have been Plan D, right?
Yeah.
Where I was being charged about $5 or $6 more a month.
Yes.
And as it turned out, apparently they assumed that I did not have prior insurance, which was not correct. Ann had to come over, I think she was on the phone like an hour trying to get this straightened around. And I just got a letter the other day in the mail saying, you were right. And I guess they're going to reimburse.
Yes, they will reimburse. And the OPRS and the GE people, what it is if you have had group coverage, either through a retirement system, through your unions, or you or your spouse continue to work past 65 and you didn't take the Part D of Medicare because you had coverage, through a group of 20 or more employees, then there's an exception to the penalties. The federal government penalizes you 1% per month for every month you weren't in a Part D, okay? But that's excluded or waived if you have this credible coverage. So we strongly encourage everyone that if you are losing company coverage or union coverage, keep their credible coverage letters that they send you. Keep the letter that you have to fill out for Part B of Medicare if you are just enrolling, because your spouse or you continue to work past 65. Because the Part B of Medicare does not talk to the Part D of Medicare. So don't assume because you've told the government under Part B you had credible coverage that they're going to tell Part D under the federal government that you had it. It's government agencies.
Now B is the
medical one. Yes.
So that's for when you go to a doctor.
Right. A is hospital, and basically you have to be admitted into the hospital, room and board, admitted into a skilled nursing rehab facility, or a in-home nurse aide or therapist. That's Part A. Most people don't pay anything for Part A. Part B as in boy is the medical. That's for everything other than room and board in the hospital and skilled nursing facility, right, and prescription drugs that you buy, at the drugstore. Okay. So it's doctors, x-rays, labs, emergency rooms, chemo, radiation, all that other stuff. Mm-hmm. That's the Part B of Medicare.
Then D is the
prescription drug. Okay, and Part C is a Medicare Advantage plan, and Part C is unique. It takes the A, the B, and the D of Medicare and rolls them all into Part C. It's usually either a PPO or an HMO. It's a situation where Medicare does not pay the doctors or hospitals. Instead, they pay the insurance company a monthly stipend to take care of you, and then your claims only go through the insurance company. You never lose Medicare, okay? You just don't use it with Part C. They kind of put it on the shelf, and if you decide at the end of the year under open enrollment you don't like the Medicare Advantage plan, or the Medicare Advantage plan decides that it's no longer going to operate in the county, then you can go back and just use Medicare paying the doctors and hospitals and pick up a supplement that covers what Medicare doesn't.
Do you find that as people get eligible for Medicare, that most of the people out there find it confusing?
95% find it confusing. The other 5% are either agents who are certified in selling it or they're lying. So, yes, it is very confusing. Under federal law now, we are not allowed as agents to come to your door. We're not allowed to call you on the phone. We're not allowed to solicit you in any manner unless you contact us. So people turning 65 get tons and tons and tons of stuff in the mail from all of us because that's the only way we're allowed to contact you. If you have people coming to your door, if you have people calling you on the phone that you did not solicit, that is illegal. You have a choice of calling the Department of Insurance. It's a $10,000 fine if they want to pursue it. So it's difficult now for people who don't understand this stuff to really have access unless they get a friend that says, hey, call this person. Where we used to be able to just go out and see if we could help you. We can't do that anymore.
I remember telling Ann when she was at the house trying to figure this mess out that I was in, I said, well, it's only $5. She goes, that's not the point. It's not right. You shouldn't have to pay something that you don't need to pay. So she cleared it up, as I said. So,
well, it's $5 a month every month
figure it
for the
out.
rest of your life.
Yeah, for the rest of your life. It's not going to go away.
Yeah. And the other thing, if you do not have a Part D of Medicare, because you don't have to get Part D, and some people aren't on medications and they don't want Part D, you have to be very, very careful if you get into a Medicare Advantage plan, the Part Cs, because most of those include the Part D of Medicare. And if you've never had a Part D and you enroll this fall, you're going to trigger some huge penalties back to the day your Part D should have started. It's a 1% per month, like we said. The government then adds that penalty to your premium every month for the rest of your life, and they want the back penalties. So it gets quite expensive. So you really have to be careful. There are Medicare Advantage plans out there that do not have the Part D, so you still have a choice, but you have to be careful.
What's this Ohio Public Employee Retirement System? Why is that changing? Do you know?
There's a lot of provisions under the Affordable Care Act, people call it the Obamacare Act, that penalizes companies and unions heavily if they have what the government considers Cadillac models, and most union contracts fall under that category. So instead of getting penalized from the government for giving you good insurance, they're saying, okay, we're not going to provide insurance anymore. Most of like OPERS and GE and some of these other companies set up what they call a health reimbursement account. Basically, they say, we're not going to provide you insurance anymore, but we'll set up a savings account over here where we'll reimburse you for the premium. So you have to go pick your own insurance and then pay the bill, and then they get reimbursed from the company. So, but a lot of it is because of the Affordable Care Act.
Now, will you have a presentation on September 3rd, or will you just take questions, or how's that going to work?
We'll do both. We do a presentation that takes a half an hour usually, and then we have a half an hour question and answers, longer if we need to.
Okay. Do people need to make an appointment?
No, you can drop in. It's open to anyone. Like I said, it's educational only. We will not discuss any personal issues just because of the HIPAA laws. But we're going to try and help guide people through this process, because if you have OPERS or GE or any of these companies that are using this one exchange, it's a company out there, they're just a go-between between the insurance companies and the people that are losing their insurance. You must go through that company to get your reimbursement. You cannot go through myself or any other agent and still get the reimbursement from the company. So what we try to do is say, okay, here's how the system works, here's your choices. We'll try and narrow it down to a couple so that when they call, you have a better understanding of what they're talking about.
Yeah, okay. And as Ann said, and I can verify this, it's not an easy subject matter. So, if you're into that situation where you're going to be eligible for Medicare, ask the questions. I mean, she'll get the answer for you, and that's why she's holding this. It's a public service, it is free, doesn't cost anything. Right. So take advantage of it, I'll tell you, because it can be very confusing. And there was something you wanted to mention.
Yeah, one thing, this open enrollment from October 15th to December 7th, that is for people who already have Part D or a Medicare Advantage plan through a private situation. People that are losing coverage either through OPERS or GE, or we don't know what's going to happen next year, but if you have a Medicare Advantage plan that's leaving the county, then you actually have until December 31st. So you're not tied to
31st.
that December 7th date. From October 15th to December 7th, they call it open enrollment. From December 7th to December 31st is called a special enrollment. So it depends on where you fall. But
I hate to sound stupid, but why do they have this open enrollment specified just for that time period?
well, it's just like when you worked. You know, you were allowed to make elections during the fall for the next year. When 2006, when they came out with Part D and Medicare and these Medicare Advantage plans and all of this, we used to be able to change all year long. When insurance companies or agents sell a product that deals with Medicare, not Medicare supplements, but the Advantage plans and the Part Ds, that has to go through Medicare. Medicare CMS has paperwork that they have to do because they control all of this, and it takes them quite a bit longer to get their paperwork done. So if we're constantly changing plans and companies, it's hard for them to catch up. Originally, it was all year. Then they changed it to October 15th to December 31st. The problem is insurance agents work Thanksgiving. We work through, between Christmas and New Year's, but the government doesn't. So they were getting way behind. Plus, you're talking thousands of agents and, I don't know, millions of people changing plans. And it's very difficult for the government to catch up. So they said, okay, in order to avoid people not knowing what's going on until May, which was happening, they said we're going to stop at December 7th, and that gives the government time to get their paperwork done and everybody's coverage ready to go January 1.
Gotcha. When should a person, if they're approaching 65, should they get a hold of you? Can they start prior to the actual birthday, or?
Yeah, your Medicare is going to start on the first of the month in which you turn 65, unless you're born on the first, and then it would actually back up a whole month. You need to contact, if you're already collecting Social Security, you don't need to do anything. Your Medicare card will show up in the mail. It's red, white, and blue. It'll have your name and unfortunately your Social Security number on it, and Part A and Part B and your start date. You don't need to do anything to Social Security. That's automatically. Insurance, figuring out what you want to do to fill the holes in Medicare. I know some people send out stuff 6 months ahead. 3 months ahead is more than enough. Insurance companies can actually write a policy at the end of the month and have it effective the next day if it's the first. So if you come August 31st and you need a September 1 date, the insurance companies can do that.
Okay.
We don't usually recommend you wait that long, but you've got between 3 months and the day before you need the coverage to start.
One of the things that Ann caught, and we couldn't figure, I didn't have a Medicare card. I didn't have anything. I didn't have any kind of cards or anything. What happened was, and Ann figured this out, they were sending my information to Ashtabula, to an address there. Wasn't that the case?
Yeah, they were using Connie, Ohio, but the Ashtabula zip code.
Yes. So consequently, apparently, a lot of my information was not even being delivered to the house. And so Ann had it on the phone, got me it, and I did get it. I got a Medicare card now, and some of the other things that I didn't have. I can't remember everything.
Yeah, they send you 5 different things. They can't package this all together to make it easy.
Believe me, they don't.
Yeah, my philosophy is dealing with the government is like getting a colonoscopy without anesthesia.
Oh, Lord.
It's painful. But if you're not collecting Social Security 2 months ahead of time, you do need to go up to the Social Security office, or just go to ssa.gov, that's the Social Security Administration.gov, which is where they usually send you, to apply for the Part A and B of Medicare. If you're working or your spouse is currently working and you're covered by 20 or more people in that group, you do not need to enroll in the Part B or D of Medicare. if you do enroll in those, your group insurance is still primary and Medicare would be secondary, which usually doesn't work real well, and it confuses doctors and hospital offices constantly. So if you're covered by good insurance through work, or your spouse has got you covered, you may want to check to see if you really want to enroll in B or D. If you're retired, even if you've got group coverage through work, you need to enroll in Part B.
Now, I was going to say something here. The no, I lost my train of thought.
CRS.
Yes. This will come to me. I know it will. No, I find that I went to the Social Security office and sat there for 2.5 hours. And when they called my name or number, I think it was, they said, all right, we can make an appointment for you for 2 weeks from now.
Yeah.
And I go, the heck with this. So I actually applied for my Social Security over the internet.
Yeah, and that's probably the best and easiest way to do it if you're not computer savvy, and more people turning 65 have worked with computers, whereas most of our 80 and 90-year-olds have not. You can always grab your grandkid or your kids.
Oh yeah, they can do it.
They can do it in a heartbeat. Same with the Medicare Part D. You know, if you're not sure how to do that on the computer, most of your children or grandchildren can get on Medicare.gov and walk through it relatively easy. As long as you have the list of your medications in your pharmacy, it's pretty simple to go through if you're used to working on a computer.
It's amazing how these young kids can actually can do that stuff. It's
Yeah, my
really
6-year-old can work on a computer. He runs the remote of the TV better than I do.
You don't have a 6-year-old, do you?
Grandson.
Oh, okay.
I have 5 grandsons.
Do you really? All right. One more time, Ian. Tell us about what's coming up.
Okay, September 3rd, Conneaut Human Resource Center, 10 to 12, free, open to the public, Medicare explanations. We'll go through Medicare A, B, C, and D and answer your questions and see if we can help you out. I do recommend, if you have a family member who is in their 80s or 90s and they're losing their coverage, please, as a child, help them out. I personally will not sit down and explain this stuff to someone who's over 80 without someone else there, just because it is so confusing.
It is.
2 heads are always better than 1, okay? And so we strongly encourage you, even if you don't understand it, to attend the seminar so you can help a family member.
Now you will have a presentation, about a half hour you said, but you
Right.
will also have a question and answer type.
Yes.
But we want to make this clear. Ian will not get into any personal things or anything like that.
Right. We cannot.
General questions.
Yeah, we cannot talk about your medications. We cannot talk about your health. The HIPAA laws do not allow us, to have those conversations in public.
So obviously, one-on-one, you could meet with them on an appointment basis.
Yes, yeah, and we, because it's an educational seminar, we're not allowed to give you business cards. The government's got 3 pages of what we're allowed to say, not allowed to say, do and not do. But if you ask for a card, we are allowed to give you one. So if you would like an appointment, you may come to me, or hopefully I have someone else with me helping. We can get you a card, or you can always call the office here in Conneaut. It's in the phone book, but it's 599-7559, or you can email me at wileyinsurance@roadrunner.com.
Roadrunner.com. And I find that easy to do too, because that's how we corresponded back and forth. And thank you so much. It's a very confusing topic, but you certainly know the answers to it. And maybe I'd like you to come back sometime too. And you're more than welcome to come back during that open
Anytime.
enrollment, because people, I guess, I didn't realize till you said it this morning how important it is that I watch the mail and check
Yes.
into changes that could be coming up.
Yes.
Yeah.
Yeah, make an appointment, because I work 80 hours a week
I
when
know you
October
do.
1 rolls around. So
All right, thank
we'll be
you.
glad to come back.
Okay, I appreciate that. I can't believe we've done a half an hour straight here this morning on the subject. Of course, I'm interested in this. But thanks, Dan. I appreciate it. Tell Bill I said hello.
Will do.